always believe that charity begins at home. We can make all the noise that we want to make, but if we do not start the work from ourselves, then it becomes like a bottomless pit. We cannot fight quackery only by condemning quacks. We must also strengthen the credibility of legitimate dental care. Every patient who enters our clinic must encounter professionalism, compassion, honesty, cleanliness, fairness, and respect. Every patient must feel seen, heard, and safe. Let me ask, when patients come to us in fear, do we reassure them? When they ask questions, do we explain? Or like our speaker was saying yesterday, do we put up the I know it all attitude? When they cannot afford a full treatment plan immediately, do we guide them with dignity? When complications happen, do we communicate with transparency? I remember, and this can happen to anyone, I remember taking out a wrong tooth of a patient. I didn't finish. I started, it was mobile. And I told the patient, I was so, but I told the patient very nicely that this is what I'd done. I finally proceeded to take out the other tooth. And the next time the person was kind, he brought me a crate of eggs. So I guess that's what honesty can do for you. So the fight against quackery begins with excellence in our own practice. We must be visible. We must educate. We must go into communities. We must speak in schools. We must use radio, television, churches, mosques, social media, and community derbers. We must simplify oral health information. We must make it easy for the public to know who is qualified, where to seek care, and how to verify a practitioner. Because where knowledge is absent, it deepens deception. To our stakeholders, to the Medical and Dental Council, the Ministry of Health, Ghana Health Service, teaching hospitals, regional health directorates, and all regulatory bodies represented here, we say this is a time for stronger collaboration. And at this point, I'd like to say I'm particularly excited about the progress that has been made on the oral health policy. And I'd like to appreciate and commend Dr. Asiedu and his team, also very ably led by Dr. Shirley Newman, for all that they've done for the oral health policy. And very soon, it would be launched. And I think they deserve a clap for that. And to show how deeply supportive we are of this, I have spoken to Dr. Asiedu, and we'll have that discussion. I'll have that discussion with my executives, but we will pledge some amounts to help with the policy. I thought you'd clap for that. We need visible enforcement. We need public education, timely investigation of reports, coordinated inspection. We also need clear reporting channels for every Ghanaian can understand. We need the public to know that illegal dental practice is not a small offense. It is a threat to public health. Regulation must not be felt only when professionals are receiving licenses. Regulation must also be felt when the public is being harmed. To law enforcement agencies, we need your partnership. Dental quackery is not merely a professional disagreement between trained dentists and untrained persons. It is a matter of public safety. When illegal practitioners deceive the public, operate without license, use unsafe instruments, and cause injury, we plead with the law that the law must respond. To the media, we need your voice. You are powerful allies in this fight. Help us expose the danger. Help us educate the public. Help us make oral health part of a national conversation. Help us make oral health part of a national conversation. But we also ask that media houses verify health advertisements before promoting them. Not every person who buys airtime to advertise dental services is qualified to provide dental care. Not every smiling face on a poster is a safe practitioner. To our traditional leaders, religious leaders, assembly members, teachers, market queens, youth leaders, and community influencers, we need you. Yesterday, our speaker reiterated how powerful these members are in our community and how far they can carry the message for us. When you hear that someone is extracting teeth in unsafe conditions, report it. When someone is moving around your communities, carrying out suspicious outreaches, report it. When a community member is harmed, do not settle. Don't settle it quietly. Report it. Because silence produces quackery and protects quackery. To the public, I say this with all seriousness. Before anyone touches you, you have the right to ask questions. You have the right to ask, are you a registered dental professional? Where were you trained? Are you licensed? Are you fit to carry out this procedure? And if you are suspicious of that, you may walk out. Your mouth is not a testing ground. Your health is not a gamble. Your life is not a discount package. We must also speak honestly about why quackery survives. It survives because some communities have limited access to affordable dental care, and because people are afraid of cost. It survives because oral health is still not treated as a major part of general health. It survives because some people believe dental pain can wait. It survives because prevention is deferred, and also because qualified dental practitioners are not evenly distributed across the country. So together, as we fight quackery, we must also expand access, which means that the young ones must also accept the postings to the hinterlands. We must advocate for stronger oral health services in primary health care. We must support school-based oral health education, strengthen referral systems, encourage preventive care, and deepen public-private partnership. We must work together. We must work toward a Ghana where every person, whether in Accra, Tamale, Kumasi, Bolga, Cape Coast, or any rural community, can access safe and qualified dental care. Ending quackery requires enforcement, yes, but it also requires access, education, and trust, and affordability. Ladies and gentlemen, the Ghana Dental Association cannot do this alone. The Medical and Dental Council cannot do it alone. Neither can the Ministry of Health. No single dentist, clinic, hospital, or regulatory body can do it alone. This therefore becomes a national movement. Today, I call on every dental professional here to become an ambassador against quackery. When you return to your clinic, educate your patients, engage your community, report suspicious practice, challenge any false advertisements you see. And when you hear of unsafe practice, do not look away. When a patient comes to you after being harmed by a quack, treat them with compassion, document properly, and guide them to report. Please don't judge them. To stakeholders, our message is simple. Look out, speak out, and report. Look out for persons offering dental services without qualification, for facilities operating without approval, suspicious adverts promising quick miracles, and for people using professional titles that they have not earned. And when you see these things, report them to the appropriate authorities, including the Medical and Dental Council, Ghana Health Service, the Ministry of Health, and the law enforcement agencies where necessary. Do not wait until someone is harmed. Do not wait until a child loses a tooth unnecessarily. Do not wait until there's an infection spreading, a family is grieving. Report early, report boldly, report responsibly. Colleagues, the mouth is indeed the gateway to the body, as we have heard so many times. Oral health affects nutrition, speech, confidence, work productivity, pregnancy outcome, chronic disease management, and overall well-being. Dentistry is not a cosmetic luxury. Dentistry is healthcare. Dentistry is science. It is skill and it is trust. And trust is what separates a profession from a trade in deception. As we begin this 35th Annual General Congress, let us commit ourselves to three things. First, we will protect the public. Second, we will uphold the dignity of our noble dental profession. And third, we will work with all stakeholders to end illegal dental practice in Ghana. We won't mind those who say that we can't stop it. As we begin this 35th Annual General Congress, may this Congress not end as another meeting with fine speeches and beautiful photographs. May it become the beginning of stronger national campaign. May it produce action, collaboration, reporting, enforcement, and may it produce safer smiles across Ghana. Let us leave here with one message. No more silence. No more unsafe practice. No more quackery. No more gambling with the oral health of Ghanaians. Together, we will end dental quackery. Together, we will restore trust in dental care and protect every Ghanaian smile. Thank you, and may God bless the Ghana Dental Association and our beloved country, Ghana. Thank you.
I think Madam President deserves a louder applause. The message is clear. No more quackery. No more gambling with the oral health of Ghanaians. Together, we'll protect every Ghanaian smile and restore trust in dental care. This is what we all pledge. It's not Madam President saying it. It is for us. Shall we give another sounding rounds of applause? And I'm sure our team that is helping us to develop something for the anti-quackery fight are taking the messages and the action points. She says action. So from here it's action. You are a part of it. You are supposed to be a part of it. So let's get up for the action. We'll take another interlude from Nkrumah whilst we prepare ourselves to receive the keynote address. can rise up and try one of the dance. We want to avoid DVT and others. So get up and shake to the drums as well. To give us the keynote address, it is my honor to invite the Director of Institutional Care Division, representing the Director General of the Ghana Health Services, Dr. Lawrence Ofori-Boadu, to deliver to us the keynote address. Please let us welcome Dr. Lawrence Ofori-Boadu.
Thank you very much, Mr. MC. I'm doing this on behalf of the Director General of Ghana Health Service, Dr. Samuel Kaba Korea, who is not available at the moment. The President of Ghana Dental Association, the representative of His Royal Majesty King Taki Teko II, and also the Chief of Staff of Gamanche, the Palace, the representative of the Honorable Minister of Health, and also the Coordinating Director for Medical and Dental at the Ministry of Health, Dr. Ernest Esiedu Kunedu, all other representatives from the High Table, GMA, and also Unilever, my respected Chief Dentist, Dr. Maswe Kujo Ajay, and the staff of the Oral Health Unit of Ghana Health Service, distinguished guests, colleagues, partners, members of the media, the Regional Director of Health Service, Greater Accra Region, who has taken leave of us for another important activity. I am Dr. Lawrence Ofrebuedu, the Director of Institutional Care of the Ghana Health Service, and I do this verbatim from the Director General of Ghana Health Service. Good morning to you all. It's a privilege to join professionals who are dedicated to protecting an essential part of the human body, that is the mouth. Oral health is inseparable from general health and well-being, because poor oral health has been associated with very critical diseases, including the heart disease, poor care of a diabetic, adverse pregnancy outcomes, pain, stigma, and reduction of quality of life. I commend the Ghana Dental Association for once again drawing the national attention to dental quackery. And the theme, Ending Dental Quackery, Restoring Trust in Dental Care, is timely, and I'm happy it's being repeated for a second year running because of its high relevance to the nation on issues of illegal practice. Dental quackery refers to dental services provided by unqualified and unlicensed individuals, including those who are practicing beyond their approved scope. It's a silent but serious public health threat that causes infection, deformities, long-term complications, and sometimes death. More importantly, it undermines public confidence in legitimate dental services. Quackery thrives where there are gaps in access, where there are gaps in affordability, and also public awareness. In Ghana, oral health personnel remain very few, and they are concentrated mainly in urban areas, while there are many Ghanaians who have never visited dentists, even in other urban cities. These realities create opportunity for illegal practitioners to take or fill the gap. The Ghana Health Service considers dental quackery as a public health emergency that requires collective action by all. First, we must intensify oral health promotion and public education so that citizens can recognize safe and qualified providers, something that the free primary health care is going to support in terms of promotion and education. Second, we must also address workforce shortages and encourage deployment to underserved communities. Through tax sharing approaches and partnership, including our collaboration as a service with very important recognized agencies, we are strengthening the capacity of non-oral health personnel to provide basic oral health education and referral. This is something that we are partnering with Unilever to support this capacity building. And in so doing, we are going to get some personnel as volunteers and also health personnel who initiate at least the education and promotive activity within the community. Third, training institutions must also ensure that curricula aligned with approved scope of practice, while practitioners uphold the highest standards of professionalism and patient care. Fourth, regulation and enforcement has been said, and I must add my voice that we must strengthen regulation and enforcement. As a service, we continue to collaborate with regulatory bodies, law enforcement agencies, our professional associations like the GDA, to identify and eliminate illegal dental practices while encouraging the public to verify credentials and report suspected quacks within our communities. At the same time, enforcement alone is insufficient. We must expand access to quality dental services, especially in rural and underserved communities, something that the service has taken key interest in terms of allocation of specialists to these underserved areas, with some incentives. The free primary health care program presents an opportunity to integrate oral health promotion, preventive services, and screening into primary health care delivery. That's the core mandate of Ghana Health Service. I am also pleased to announce that with the support of the ministry, the Ghana Health Service will launch the National Oral Health Strategy 2026 to 2031 before the end of this year, something that we have taken key interest in it. This first ever national strategy will provide a roadmap for strengthening oral health, especially in the area of workforce, and improving public education, integration of oral health into primary health care, and expanding access to quality services. Ladies and gentlemen, Madam President, ending dental quackery is a shared responsibility. The oral health professionals must practice within their scope. The GDA, that's Ghana Dental Association, must ensure that we have safe environment in areas of our practice. Regulators must also enforce standards, and the community must promote awareness, and public must seek care only from licensed practitioners. Together, we must support the implementation of the National Oral Health Strategy and restore confidence in professional dental care. As a service, and as Ghana advances towards universal health coverage and sustainable development goals, oral health will remain an important component of our national health agenda and a critical part of the free primary health care agenda in areas of health promotion and education, as well as training general practitioners to go down there, at least to identify and refer to appropriate practitioners to manage. Let us renew our commitment to protecting Ghanaians from preventable harm and ensuring safe, accessible, and quality oral health for all. I wish you a successful Congress. Thank you very much.
Thank you very much, Dr. Ofori Buedu. To deliver to us the guest of honor's message, which is from His Royal Majesty King Taki Teikuchru II, Ghana Manche, and the President of the Ghana Traditional Council. It is my honor to invite Lady Justice Julia Na Laye Ajay Amwa, the Chief of Staff of the Ghana Manche, to deliver her message. Chief of Staff has a little challenge with her knees. So with your permission, she will sit and deliver the message on behalf of the King. Thank you very much.
I have been given a special privilege to sit and deliver this message. If you want to know why, you can speak to me later. But it's a very, very special privilege. The president of the Ghana Dental Association, Mr. MC Name Nananum, may I now stand on existing protocols. Ake ago. Ake ago. Ake ago. Niga ke nyabake. It is a great honor and privilege for me to sit before you this morning to give these remarks at the opening ceremony of the 35th Annual General Meetings. I am respectfully reading this message on behalf of His Royal Majesty, King Taki Teikochru II, the Ghana Manche, and the President of the Ghana Traditional Council, who is unfortunately unable to be with us today due to some equally urgent matters. He sends his warmest regards and wishes the organizers a fruitful and successful event. It is both a pleasure and an honor to join you again. This year's theme, Ending Dental Quackery, Restoring Trust in Dental Care, is opportune and profoundly important. It speaks not only to the integrity of the profession, but also the safety and health of the people whom you serve. This gathering provides an important opportunity not only to review the achievements of the past year, but also to reflect on the challenges before us and chart a clear path for the future. The dental profession occupies a critical position within our healthcare system. As we have heard, it is the gateway. I wish to commend the association for its efforts in promoting continuous professional development, upholding ethical standards, advocating for the interests of practitioners, and supporting initiatives that improve oral health outcomes. Distinguished guests, ladies and gentlemen, as you deliberate during this meeting, I encourage you to embrace constructive dialogue, innovative thinking, and collaborative solutions. Let us continue to seek ways to improve service delivery, expand access to oral health care and leverage new technologies and research to enhance patient care. Thank you, and I wish you a successful and fruitful meeting. God bless us all, and God bless our nation, Ghana, and make us strong. Thank you.
Oyualadon. Thank you to me and the Ghana Traditional Council. We are most grateful. Next on the bill is the special guest of honor's address. We are glad to have with us this morning the head medical and dental program, technical coordinating directorate of the Ministry of Health, Dr. Ernest Konedu Asiedu, representing the Honorable Minister of Health, the special guest of honor of our 35th Annual Congress. Let's welcome Dr. Asiedu.
Thank you very much. Good afternoon to you all. When Lady Justice took the microphone, she said that it was a privilege and that if you are interested in that special privilege, you can see her. But I was just imagining that I may be standing in a box like this and Lady Justice is seated in her seat. So I'm sure in our minds we can guess what is happening. Where Lady Justice don't stand, they sit down. So, okay. So the president of the Ghana Dental Association, Dr. Cecilia Kakraba Kwashi, who I was sitting comfortably by, Lady Justice Julia Na Yale Ejay Amor, the Chief of Staff, and also representing His Royal Majesty King Takiteko Chum II, the Ghana Manche and President of the Ghana Traditional Council, and her royal entourage. I was very, very happy to see them standing behind her. How I wished that I would get some two ladies. So the representative of the Director General of the Ghana Health Service, Dr. Lawrence Ofori-Boadu, representing Dr. Kaba, my colleague, because the Ministry of Health is also located within the Greater Accra region, Dr. Roberta Messia, who sought permission to also be part of the 100 years celebration of the Princess Marie Louis Hospital. Dr. Frank Vado, Vice President of the GMA for Greater Accra Region Division, representing the President, Professor Ernest York. Representing Unilever Ghana PLC, Glenn Abraham Ampoma, who is the branch manager for oral care. I think Pepsodent branch manager, right? Thank you. Various registrars of the Medical and Dental Council, Health Facility Regulatory Agency, and other sister agencies that are here. President and representative of sister professional associations who are also here. The dean and other lecturers, from the School of Dental, University of Ghana Dental School, and other dental schools that are here. Especially want to recognize Professor Sandra Hewlett from the University of Ghana Dental School, who is the Dean. Members of the Ghana Dental Association, distinguished guests, ladies and gentlemen, the media who are also here to take this far, and then colleagues who are also joining us online. It is a privilege. I guess it's a privilege for all of us to stand before you and to join the 35th Annual General Congress of the Ghana Dental Association. For 35 years, the Ghana Dental Association has served not only as the professional home of dentists in Ghana, but also as a steadfast partner in our collective effort to improve the health and well-being of the Ghanaian people. I commend the leadership and members of the association for this unwavering commitment to excellence, ethical practice, and service to humanity. I recognize the immense sacrifices made daily by dental professionals across the country, from our teaching hospitals and urban centers to district facilities and private practices. Often working under challenging circumstances, you continue to provide essential oral health care and uphold the highest standard of professionalism. Your contribution to national development is deeply appreciated. I also wish to acknowledge our young doctors, dentists, and house officers who represent the future of the profession. Your passion, innovation, and commitment gives us confidence that dentistry in Ghana will continue to grow from strength to strength. Oral health is not a luxury, it is an integral part of overall health and well-being. A healthy nation cannot be built without healthy smiles, and strong health systems cannot exist without strong dental profession. As a ministry, we acknowledge the challenges confronting the profession and remain committed to constructive engagement and will ensure dentistry in Ghana continues to thrive. I think the Regional Director of Health Service and also the MC talked about the fact that the mouth, is the doorway into the body. And I recall that when he mentioned that if he had maybe a very poor dentition, he wouldn't have been able to stand here. I just remembered 5 years ago, 4 years ago, that the COVID-19 gave that opportunity for us to hide the lower part of the face. And typically, if anybody removed the mask, then you actually see that the face is not the upper part, but the face is actually the lower part. Ladies and gentlemen, this year's theme, Ending Dental Quackery, Restoring Trust in Dental Care, is timely and of great national importance. I think that this has run 2 years in a row. Quackery represents a serious threat to public health. It undermines the years of rigorous training undertaken by legitimate practitioners and exposes unsuspecting citizens to needless complications and avoidable suffering. The Ministry of Health shares the concerns of Ghana Dental Association regarding illegal practice and recognizes the need for stronger collaboration among all stakeholders. Accordingly, the ministry will continue to work closely with the Medical and Dental Council, the health facility regulatory agencies, and other relevant institutions and allied professionals to strengthen regulatory